how do we stay adrift in all of this, in this like rageful sea that we are in right now? And I recognize that. And so we worked with, some of the folks to put together this kind of protected day off where we were able to just connect with each other, meet each other face to face, which we hadn't done because of all the social distancing policies, to, talk to mental health professionals, which when is there time to talk to a mental health professional in a doctor's work day? So all of those things were important, but it was a one-off thing. It's happening annually, but again, it's a one day a year sort of thing. And so my big focus and my hope for, what the power of words can do, and, what I hope the medical community can shift into, is more of those small daily moments, the ways that we can use our words. We can use visual symbols like, having warrior, optimism, empathy, right on your wrist, right on your, shirt, on your scrubs, like something that you can serve as a signal to somebody else of, this is what I need more of today, or this is what I want to give out today. That is, I think, something that would absolutely transform not only, your patient-doctor interactions, being able to connect with a patient who may be wearing one of these or who may feel more open to express how they're feeling that day, but also from doctor to doctor, from nurse to nurse, from, CEO to front desk staff. Like, I think that ability to just be able to connect and to recognize that there may be something under the surface that somebody is experiencing is huge. And I think those are the ways in which we can fill that cup that we so commonly are pouring from and emptying out.
Wow. Yes. We don't realize, right? We go in to see a doctor with our problem and expect him to show up or her to show up at 100% and, give me the pill and make me better. And not realizing that we keep emptying from their cup each time they see a patient. And I realized that as well. And, but it took me a long time to understand it until we talked so much, and especially during the pandemic. I can't even imagine, being in someone else's shoes, and I'm quite empathetic to be in the doctor's shoes, because you don't know what you're taking home to your family, after leaving a hospital.
Right.
So I just saw it as such a great communication, because it's unspoken, but you're still able to share something really powerful that you're feeling at that moment in time, and you can't talk about it because you really don't have the time to talk about it.
Exactly. And so much of the, history of medicine is around being so kind of buttoned up and, put a mask on and just be professional. And I think what I've appreciated about this generation of physicians, and like kind of my generation, the sort of social media doctors, I guess you can call us, is, we're taking that mask off and being less guarded. We're taking that boundary or that wall out between doctor and patient. And I think that's part of what I've been able to be most effective with my patients, when they don't feel that sense of like power imbalance or hierarchy where they're like, oh, okay, we'll have to sit up straight, and I can't mention certain things to my doctor because I'm afraid of how they will view me or that they'll judge me. And I'm like, no, like, you're human. I'm a human too. I just spent a lot of time in school, but so I can help you navigate through this thing. But, you have strengths, you have knowledge that I don't have. Like, let's work through this together, and let's, figure this out together. And I think a lot of people react very well to that. They respond well to it, because it is true. There's so much to healing, and there's so much to feeling whole outside of just, here's this medication, here's this supplement,
this emotional connection that you need to have with people. That's part of the healing as well.